Hi, everyone. Welcome to today's webinar. Thanks for joining us today. I'm glad you could be here. I'm Sarah Brandspiegel. I'm an instructor at the Colorado School of Public Health, where I work with the Program for Injury Prevention, Education, and Research, also known as PIPER. And we facilitate the National Peer Learning Team on Child Maltreatment Prevention, which is a national network of people working in public health and social services who come together to learn about primary prevention approaches to child maltreatment. And our network is funded by the Centers for Disease Control and Prevention, and it's a partnership of PIPER at the Colorado School of Public Health and the Colorado Department of Public Health and Environment. And we're really excited to be here today as part of our series of research in progress webinars on preventing adverse childhood experiences and child maltreatment. And the focus today is the Violence Against Children surveys, which provide important data that can be used to inform prevention planning and action. And we'll be learning more about findings from the US and around the world with Dr. Andrés Villaveces today. So thank you for joining us. I want to start with some quick housekeeping to just let you know that you can use the Q&A feature in Zoom to ask questions throughout the session. So please enter your questions as you think of them, and we'll have time at the end for question and answer with Dr. Villaveces. Also, this session is being recorded, and the link will be shared for the recording, and also the slides will be shared for everyone that registered, and they'll be posted on our website. And when you end the session today, you'll be directed to a feedback survey. If you can take a few moments to share your feedback on the session and your ideas for future topics or presenters that you'd like to hear from, we'd really appreciate if you would take some time to do that. Also, I want to let you know that the recordings for our previous webinars in this series and the slides are available on our website. They've covered a range of different topics that you can see here. And you are welcome to access those if you missed any that you'd like to look back at. And registration is open for the upcoming webinars that we have scheduled for the coming months. And these cover a range of different topics, including low-income housing tax credits, hospital-based prevention strategies, policy approaches, community organizing as a strategy to prevent adverse childhood experiences. So I'm really excited about all of the presenters that we'll be hearing from and the research projects that they'll be talking about. And I'll put a link in the chat for everyone to send you to the page where you can register for these upcoming sessions. So now I'd like to introduce our speaker today, Dr. Andrés Villaveces, a physician and epidemiologist with over 25 years of experience researching injury and violence prevention. He currently works at CDC as senior scientist, leading the implementation of the Violence Against Children and Youth surveys in Latin America. And he's also worked at the World Bank, the RAND Corporation, University of North Carolina at Chapel Hill, and the World Health Organization. So we're so glad that you were able to join us today to share your work, and I'll turn the floor over to you to pull up your slides.
Well, thank you very much, Sarah, and good morning or good afternoon to you all. Let me just set up my presentation here. A lot of the topics or the theme and focus that I will speak about today is centered on experiences in the global setting, but it has considerable applications for US domestic settings. So much of the information that I'm presenting and I will be talking with, which is related to where we do this surveys, is in other countries. But like I say, a lot of the tools and the strategies and the procedures or the way of thinking is quite applicable to local settings, to state settings, and even the national setting in this country. So that is, I think, an important aspect that I want you to be thinking about as I present and I talk about these particular issues. I think I will turn off my video while I do the presentation, and I will just stop my video. Okay, perfect. So the Violence Against Children surveys have been an activity that the CDC has been doing with a series of partners throughout the world for quite a few years, since 2006 it started. And we have developed a series of strategies and tools around this process. So I'm going to talk a little bit about how we do the survey, contextualize the survey, how is it done, the methods, some of the results of the survey, and then transition on what is it that we use this data, how do we use these data to actually generate action, create policies, and do different sort of implement different strategies globally, but also in the domestic setting, like I mentioned. So why do we do this? Why is this important? What is the burden of violence against children in the world? Well, it's a very big problem. We know that about 1 billion children of the 2 billion children that are globally, about half of the children actually experience some type of violence. In the course of their childhood, about 1 in 4 children suffer physical abuse, 1 in 4 girls and 1 in 13 boys sexual abuse. And sexual abuse among children is 30 times higher and up to 70 times higher physical abuse than in actual official reports. So surveillance systems capture a very small part of what actually is happening in the population. And of course, homicide, the most egregious and severe manifestation of violence, is among the top 5 causes of death in adolescents globally. So it's a very big problem in the world. Violence also is expressed throughout the lifespan and manifests in different ways through child maltreatment, bullying behaviors, youth violence, dating violence or intimate partner violence, any form of sexual and gender-based violence throughout the lifespan, or emotional and psychological forms of violence or witnessing violence. So it impacts our life and it manifests through our life in many ways. And violence has a lot of effects in the life of people, not only through the manifestations of physical injury and physical forms of violence, but also psychological and mental health problems, PTSD, suicide, depression, anxiety, sleeping disorders. It also has effects on maternal and child health, being associated with fetal death, with pregnancy complications, unintended pregnancy among adolescents. And it has also been linked to a lot of risk behaviors. Many of those risk behaviors, when they become chronic, they actually lead to chronic diseases and premature death. And so violence has a considerable amount of effects. And this is only talking about the health component. I could add many more if I talk about other social issues like education or work, etc. But you can see how violence has these components. And all this violence occurs within a subset of society that sometimes facilitates a lot of those behavioral changes through adverse community environments where there's poverty or where there's inequalities, racism, xenophobia, lack of economic opportunities. These are breeding grounds for a lot of those behaviors and for the occurrence of violence to manifest and have that negative effect among individuals through their lifespan. So given this problem, given the implications it has for the life of people and throughout their entire life, we have decided to, first of all, understand this problem and tackle this problem in many ways. And we have done this, and we believe that this is better done through a partnership. We work under the umbrella of a private-public partnership called Together for Girls, which involves a bunch of the institutions that you see, many UN institutions, governments like Canada, the United States, many institutions within the US, and some private institutions that collaborate to actually bring this issue of violence against children globally to a higher to the attention of policymakers and the population as a whole. And we do believe that this collaboration is essential to actually engage better with different countries. We approach, and this joint collaboration contributes to better approach different countries and work with them. And once we approach a country, and once we have a country that is interested in working with us on establishing or determining the magnitude of violence against children in their setting, then we set up a similar local collaboration where we have different entities of the government participate. We have UN institutions, different United States government or other government institutions participate, academia, civil society, and we all work with a common goal. We all work within a multi-sector sort of approach, and use this data or this information as an advocacy tool, but to also bring this to the attention of the population, to break the silence, to start a new conversation, to generate action. And so I'm going to tell you a bit more about that action component. We have done this survey so far in about 23 countries. You can see in the map in red the ones where we have completed the survey, in blue some that we are repeating. In Kenya, Zimbabwe, we already finished those. We're repeating in Eswatini, and we are in progress working in Ethiopia right now, and we're doing actually a pilot study in the United States, mostly working with the city of Baltimore and a rural county in Maryland, where we are testing a lot of our methods for application in a US domestic setting. Because in any country, pretty much any country in the world, the actual magnitude of this problem is not well understood. And so this is a survey that delves much more in depth and asks children directly about their problem of violence. Once we collect the data, we actually produce a bunch of reports. And here you can see just examples of those reports. We also have data sets that are available publicly that can be analyzed and where data can be further explored. And this, as we increase our work in a variety of countries, we obviously are covering more percentage of the global population of youth and then getting a better image globally of the problem. So the surveys per se are surveys that seek to assess that burden of violence, that look at information on perpetrators, the context in which it occurs, look at some of the health consequences. This is related to those adverse childhood experiences. So we look at mental health, substance abuse, sexually transmitted infections, health risk behaviors, and we look at a series of contextual factors that might be protective among family, friends, or community, as well as how people utilize or not services. Some of the surveys have a module on HIV, so we also do some work on HIV and violence and do some counseling on that area. And some other surveys have some modules that look at migration and how violence and migration are related. The survey addresses physical violence, sexual violence, emotional violence, all these risk factors that you can see on the screen, and gender attitudes. And so it's very comprehensive, has about 263 questions, and it can take up to 1.5 hours to actually conduct per individual. The way it works is we do national household surveys. We interview children and youth between 13 and 24 years of age, males and females. And we do this through a three-stage cluster sample design that basically we randomly select a geographic area in a country. Within that area, we randomly select households. And within each household, we randomly select an individual, either a male or a female, and we actually interview them and get that information. This is usually carried out and led by country institutions. So it is the local setting that leads this process. And think about an application in the US, a local setting that knows more, its own institutions, its own priorities, et cetera, would be an ideal leading agency. And we also do, of course, a lot of extensive training in terms of the protocols, not only for collecting data, but addressing issues that are very relevant to children, to ethics in research, to violence, to gender-related issues, as well as we have the modules on HIV. What have we found? I'm going to just show you some summary findings throughout the world. So we know that for any form of violence, there's actually a very high prevalence of children. As I showed you in that initial slide of the burden, here we can get a much better sort of sense of the variations that exist in a variety of countries. But even in the countries that report the smaller sort of prevalences of violence, it's up to 1 in 5 people. So it's a still very high percentage of children and youth who are reporting being exposed sometime in their lifetime before they were 18 to any form of violence. So here you can see the between males and females, the difference and any form of violence. We look at sexual violence, and one of the things that we find is that typically in the majority of the world, sexual violence affects mostly females than males. In some countries, that's not the case, in very few countries, but for the most part, the different forms of sexual violence are affecting more females than males. And it is also a big, unacceptably high percentage of children who are actually exposed to this form of violence. Physical violence is more prevalent overall, and we find wide variation up to, in some countries, up to 3/4 of the population actually refer being victimized by sexual violence. And so incredibly high rates of violence and with a wide variation between countries. And then emotional violence. Emotional violence, incredibly important also, very high rates, in some places higher among males than relative to females. In other countries, it's the reverse type of relationship. And emotional violence is really important because emotional violence has been linked or associated to very bad or negative consequences in mental health. We look at mental distress, anxiety, and depression. We find that people exposed to emotional violence have much more negative or mental distress than people who have not been exposed to emotional violence. So there is a relationship between that and negative mental health outcomes. In the more severe cases, we also find that suicidal ideation is much bigger amongst people who have experienced emotional violence relative to not experiencing it. And so being exposed to violence, this is just one example of how those exposures to violence are related to those negative outcomes. And it reinforces that diagram that I showed you at the beginning, how violence has negative consequences in a wide variety of aspects of the lives of people. We asked them about whether they tell someone or not about their experiences and if they use services. And what we consistently find is that in the case, for this example of a few countries, people tell someone for the most part that they actually were victimized. They share that with someone they trust. But when it comes to knowing what to do about it, there's a smaller percentage of people who know where to go, what to do about it. And then relative to the people who told someone, very few actually seek help, seek services and seek help, and an even lower percentage actually get that help. So when we look at the data that we're capturing through administrative systems or surveillance systems in countries, we know that it is a very small, tiny percentage of the people that are actually experiencing these problems, which is why we do this in the form of a survey, capture this from the whole population. So once we collect the data, well, what do we do with it? One of a very sort of important thing of this survey is that the information of the survey is used for prevention, is used for action, is used in a meaningful way so that the situation that we find in a specific country will be changed in the future in light of what we know. Typically, we have institutions, and this diagram just resembles what many tasks or missions or efforts or interventions institutions do in an uncoordinated way. Here in the US, we have a problem many times, and many of you perhaps have experiences of how siloed institutions are. Child Protective Services perhaps doesn't talk enough with healthcare institutions. Legal institutions don't talk enough with healthcare or with social services institutions. And so we have siloed interventions, many of which have their own missions and goals, and perhaps have set up really interesting programs. But when there is no coordination at local or state level, we can have efforts that are duplicated or they're acting in oppositions, etc. And so that makes our investments and our sort of activities a bit more complicated and less efficient. So what we want is really to engage everyone in a common objective to have a collective impact. But how do you do that? How do you manage a lot of people with perhaps different agendas to engage in that collective impact? There are a series of strategies in key areas for achieving that collective impact. It is clear, it is important to have a clear logic model. Where do we want to go? How is it that we're thinking? And what framework are we following to sort of come or start from point A and then in point B, which presumably is a point where we have less engagement, less violence against children. We use a series of technical packages to aid us in getting from one place to another, and we monitor our progress over time. And we do that through partnerships. I mentioned the international partnerships, but the government sort of structure that we create, which are incredibly important. We do not conduct a survey, and we don't do these activities if we don't have already a partnership and a multi-sectoral partnership that is formed. And of course, communication and political commitment within that partnership is really important to actually effectively engage in change. So if you're thinking about political commitment at a local level, it'll be very different. Maybe you want to engage a mayor, maybe you want to engage a coalition that has some political leverage in a specific locality, or at the state level, one can think about working with the state legislatures or with a series of leadership individuals in your state that might want to engage and come to a common agreement in this particular work. What is the framework? So we use a framework that we created. It is a framework called the Inspire framework. And this is a tool that we have created, a variety of institutions, the UN institutions, the World Health Organization, CDC, and all the institutions that you see at the bottom of that page. And what this does is it has, excuse me, come up with 7 strategies for ending violence against children. Those strategies actually represent and are linked to best practices for preventing and responding to violence. They reflect the best evidence of what works. And so they are mapped to actual interventions that we know that work, and where there are sufficient methodological evaluations that we know those interventions work. And then we have also strategies that are based on very strict criteria about the work. The package of tools that we have, is not only the framework, but also has a handbook that is attached to it. And that handbook actually helps us translate or adapt some of the interventions that might be useful in one setting into another setting. And then we have indicator guidance and results framework, which basically has the tools for monitoring and evaluating where we want to go. So this is overall the strategy that and the technical package that we use for this purpose. In the end, what we want is to increase the number of interventions that are linked to the 7 strategies that are mentioned here: implementation of laws, norms and value changes, safe environments, parental and caregiver support, income and economic strengthening, response and support services, and education and life skills. That further, or that higher sort of increased activities on this different 7 areas should lead eventually to a reduction in the prevalence of violence against children. So in the end, we want to implement these strategies to reduce violence. To do this, and more specifically, once we have the data, we want to transition from data to action. And we do this through a series of activities that are very much discrete in time, but also are part of a wider and mid to long-term process. So we do a workshop that is called a data to action workshop. Once we collect the data and we know the data are clean and we have some indicators of the data, we want the countries to use those data, and that multi-sector force, we want that multi-sector group to actually start thinking about that information and link it to evidence-based strategies using that Inspired technical package, so that we can respond in an informed way towards what needs to be done in a particular setting. So we conduct the survey, we interpret and disseminate the data, share it with this group of sectors, and then we work with the group to actually implement that framework and figure out which are the priorities that need to be implemented in a particular setting. That activity leads to some recommendations that will form eventually, and ideally, a national action plan to address violence against children. In the US, one could think of a plan that is a city plan or a county level plan, or even an institutional plan or a statewide plan for preventing violence against children. One could think about the different levels, and this is by no means applicable only to a national setting, but it can be actually expressed and implemented in a variety of settings in a determined place. A national action plan, in essence, is a document that is endorsed by a government or by policymakers that has some priorities, some goals and objectives, and some coordination mechanisms that incorporates this group of different sectors to address violence. We need people from education, from justice, from health, from social services, from a variety of sectors. And so it brings all this group together. It assigns responsibilities and accountability mechanisms. And in doing so, we actually engage in this coordinated effort to reduce duplication of efforts, maximize resources is really important. In the situation that globally and chronically we are of lack of resources or insufficient resources, this is incredibly important to reduce that duplication, to actually maximize the efforts. Different institutions and different sectors participate. Here, just a few examples of sectors that we involve. Community groups, civil society, faith-based organizations, justice and law enforcement, education, health, policy and finance. Very important to think about what are the costs of this, what are how much this is going to cost us is really important. And so we go through a planning process, a development process of the plans, a process of implementation, and then monitoring of the plan over time. And later on, we repeat the survey. And then presumably what we want to see, if everything has worked on, is that those indicators that we measured at baseline are going to be different. Hopefully all or many of those results are going to be reduced over time as we implement these national action plans and these data-informed priorities. In the planning phase, we established that steering committee that I mentioned. We look at the overall situation, what is the epidemiology? What do the data tell us about the problem of violence against children? What are the big issues? And what are existing policies and programs or interventions or collaborations in the country? That is important. Where are the gaps? So it gives us a mapping of where is it that we're working, how this is important to define. In a second phase, we define, and using the data, the priorities. We select different interventions and action. We define what resources are needed, some goals and a time frame, responsibilities, and how is that going to be monitored and evaluated. And then we adopt, the different countries have adopt the plans and integrate their plans, allocate budgets, hopefully to these different components of the plan, and then start engaging and communicating about those activities through implementation. And over time, we obviously monitor this and we see how progress is being achieved and how close or not close we're getting to the goals that we had defined. So in the workshop, what we do is we help the different people understand that this is the objective of where we want to go. While the workshop is discrete in time, this workshop leads to a process that is much more longer in time and has applications over a medium or long-term basis. And we want our participants to actually understand the basic components of a plan, understand obviously the framework and that logic that we are following through the framework of Inspire, and help them start using the data that has been collected through the surveys to actually generate some priority indicators, to define what are the gaps and opportunities, and to use and identify the ideal evidence-based strategies that should be applied in a particular setting. And then to generate and transition into the actual implementation of the plan. So the workshop starts generating some priorities, but those priorities eventually transform into a national action plan that has a longer sort of way of developing and follows those processes that I mentioned. So let's look at an example, so I can take you through what we actually do and how we do it with a particular country. Country X, we have a series of indicators that you can see on the slide here, and those indicators are tied with the data that is collected on prevalence of the different indicators. So we have 26 indicators. I'm just showing you here a few, and those specific indicators are just telling us the magnitude of a problem. So what we do is we divide the different sectors and we go topic by topic and ask them to actually generate a series of priorities based on the indicators that they have. So maybe the justice sector sees the importance among some of the data here and highlights some of the indicators. And those indicators could be different from the health sector. And those indicators could be also different from the child protective services sector. So all the different groups are going to be engaged in looking at this information separately, coming up with some priorities. So we give each sector the opportunity to actually express themselves and assign those priorities in the form of a specific sort of sentence or definition. That definition of priorities will lead to a series of sort of reflections on, okay, what is it that we have around it? What if I identify a specific topic of importance, what is my particular setting or sector doing in relation to this, and what are the goals and what should we be doing about this? For example, the social service sector here could, with those data that I presented there, they could have selected corporal punishment and physical violence by caregivers as an important area. And they put their priority as, you know, the evidence from this country suggests that there's a lot of physical violence in the home and in the school through corporal, even though corporal punishment is prohibited in that particular country. And there's obviously a need to change the norms and values and to change and to sensitize and educate the population around this and around options for positive discipline in all these settings instead of using corporal punishment as a strategy. So this particular sector selects two of, let's assume that's that social services sector, they select two of these priorities and they have deemed that these two are really key and informative of the priority that they want. So very, very high, unacceptably high levels of physical violence amongst females and males. And they also find among that list of indicators that parents and caregivers use a lot of physical discipline and verbal aggression. And other indicators of the survey tell us that a lot of people, especially males, agree that corporal punishment by parents is necessary. So the different indicators that are used and the data that are collected from the survey and presented to each sector are selected, and the sector eventually, each group within the sector prioritizes what the issue is and selects a series of priorities. They can select up to 3 priorities, sector by sector. And then what we do is we summarize those priorities of all the sectors. We actually summarize what the different sectors have done to come up with a sort of global set of priorities identified by that whole multi-sector force and how that reflects for the particular country. Once the priorities are selected, we map them to interventions. And that's where the framework of INSPIRE is important, because those interventions help us define what specific evidence-based actions we can implement that are related to physical punishment, in this case, to corporal punishment. And so the way we do that is that the indicator guidance that you see on your screen, the blue page that I showed you at the beginning, has some indicators and it has a number, but that number is mapped to the framework and to the logic, the INSPIRE framework, and it identifies a specific strategy of the INSPIRE framework, and it actually goes further and identifies interventions that are useful to address that strategy. So in the first one, in second line, you can see community mobilization programs for changing norms and values. And that is related to gender-based violence. So on page 40 to 41 of the package, you find a specific program called SASA. SASA is a program that has been proven to be effective. It was initially done in Uganda, but that has been implemented in many countries and has shown that it's very effective in reducing gender-based violence. And so we link the data to the priority, through the priority that individuals in each sector have selected, to a specific strategy within the framework, and that strategy it can be mapped to a specific intervention. Now we know that many interventions that are here, these are not all the interventions that exist that are probably evidence-based. So that's why doing a mapping of what exists in your locality is really important. That's why I need to know if I'm working in the state of Oklahoma, and in the state of Oklahoma, there are some good norms and value changes programs that have their own name and that have been implemented locally, that we know they work. Then maybe I want to actually focus on those, or maybe I don't have to do SASA, but it's a type and an example of an intervention that I would want to do to engage in those activities. And in that same process, we identify up to 3 priorities from each sector. And then what we do is we eventually each sector ends up selecting, okay, I want to work on 4 particular areas, some that are related to improving the care of people, some that might be related to giving parental and caregiver support, some that are related to norms and values, and some that are related to legislative or enforcement of laws. And so each sector will select those different topics and come up with their own priorities. They will define also, once they have done that, then what we define is, okay, who has resources about this? What are the needs? What do we need to actually get this moving in a particular setting? If I'm doing it at city level, what would we need to actually put in place a citywide norms and value change program? Who and how do we define the goals, and what is the time frame for implementation of this? At the country level, many countries use their they have development plans, maybe they're linked to a government or a specific administration. What we want to do in many cases is to actually make sure that this transcends a very specific political administration, but rather goes in time. And so we want to focus it. Many times we link it to, for example, the sustainable development goals, to international goals, or to goals that a country or a particular setting has subscribed to and supports. We define the responsibilities, who's going to do what, and who's going to lead this process. And then when every sector has done that, we can actually summarize. So we know that of all the sectors that we have here, we have a sector that represents maybe international agencies in a particular setting, the education sector, the justice sector, the child protective services sector, and the health sector. So there are multiple sectors there, and each one has come up with priorities 1, 2, and 3 for them. And here what we see is that of all those sectors, many of them actually, through their own discussions in these workshops, come up with sometimes the same priority. So in the end, the actual priorities that are identified by all the sectors are a total of 9 priorities. And those 9 priorities we have mapped into, for example, physical violence of parents and caregivers. We can have legal strategies for that. We can have norms and values strategies for that. We can have safe environment strategies for that. And so some of those priorities touch every single one of the strategies of Inspire. Some might be more related, the way they are framed or the way they are expressed, to 1 or less sectors. And so that helps us identify the sectors. And then eventually, using the Inspire set of 7 strategies, we know that for country X, the whole work and the whole activities that were done by a sector focused and highlighted interventions in each one of the 7 strategies, but it specifically actually emphasized a little bit more the N, which refers to norms and value changes, the P, which refers to parental and caregiver supports, and the E, which represents to interventions on education and life skills. That means, and that gives us a sense of recommendations for the design of a national action plan and where maybe the priorities of the national action plan can be focused. This, of course, it's an iterative process. As more people get involved, maybe some of these priorities can get revised, enhanced, or eliminated because of budgetary, political, administrative conditions, etc. But the important thing is that from the get-go, all of these priorities are actually linked to data, and those data have been evaluated by a variety of people who have different approaches, discussed, and then come up with an agreement of what should be done. Eventually, an action needs to be defined, and perhaps one can identify where are the funding needs, what is happening around that, whose responsibility it is to lead this process, and set up some very defined goals in relation to what's going to happen. So by some measurable goals that, established in time, we can say, okay, by this period, we are going to do specifically these activities, or they can be framed, of course, in terms of objectives towards either reducing physical violence or corporal punishment, to use the example we have been talking. Ongoing communication, and very important, of course, political support. So this is a summary of how we use the Violence Against Children surveys data to actually engage in national action plans. In recent times, we actually, I showed you at the beginning a map where we have done these surveys, and in that map, we have actually repeated a few countries, and Kenya was there. This National Action Plan of Kenya and some evaluation of some of the core key indicators of Kenya have shown that between the first survey after the National Action Plan and all of these activities and the second survey that we have done, there have been substantial reductions in violence against children. So it is sort of case of an example where the implementation of this National Action Plan has actually contributed. I can't tell you exactly which interventions contributed more or less, but overall engaging in this evidence-based activities and implementing interventions that are evidence-based contributes to reduce violence against children. This is the work that we are doing, that we want to continue doing. And of course, in the presentation, it might sound like a very straightforward type of exercise. It never is. Reality is very complicated. Of course, there are political issues that arise. There are challenges that arise, economic, unforeseen challenges, for example, a pandemic, sometimes a hurricane, sometimes a revolution or an internal conflict in a particular country. Many issues that happen. Still, I think these activities are worth doing and have actually served as a very good strategy for reducing violence against children. With that, I will stop my presentation and we can actually engage in some discussions. Thank you very much.
Thank you so much for your presentation. That was fantastic. I did lose internet for the last 5 minutes, so I may have missed something important, but I did have a few questions that came up for me that I'd love to start with, and then we can go to some of the questions that have come in from audience members as well. So the first one, I just want to say that I think the INSPIRE framework is fantastic. We hear a lot from folks that they really are looking for a roadmap for a public health approach to child maltreatment prevention. And what you're describing, I think, really addresses that and walks people through the process. I am curious what challenges you find in bringing people along to thinking about sort of primary prevention strategies and using evidence-based strategies in different contexts.
Yes, that's very important, and not. I mean, sometimes one finds more than resistance. It's more sort of a lack of understanding, which is, I think, one of the biggest and the core elements is from the beginning, when we start doing this exercise of data collection, is to involve everyone in this process. That way they understand the framework, but they participate in the process of collecting the information. They see and they evaluate the information once it's collected. They interpret the information, and then they participate in the generation of responses, which is why I was mentioning at the beginning, from the get-go, we want a coalition, a multi-sectoral group to work. To give you an example, a domestic example, we're doing a pilot in the city of Baltimore. So we're engaging in this exercise, and why we're doing it is just because we want to make sure that the way we collect the information and how we do it in the context of the US is appropriate for the US and will ensure high quality of information. But involving institutions from the beginning and involving and engaging the multiple sectors, communicating with them, explaining why this is important and how they can use from their own perspectives the information is really essential in getting their participation, their buy-in. Once they know how this information can benefit them, I think the process flows in a better way. But initially, the presentation and the communication of why this is important is really crucial. We do that from step one. We actually form these committees from the beginning, before even collecting the data.
Excellent. And as you were talking, I was thinking, who participates, not just the types of organizations from that in that multi-sector collaboration, but also who the individuals are from those organizations seems really important. And I wonder if there's any best practices about how do you get people to the table? How do you convince them that this is even worth their time to think about these types of issues?
That's a really good question. That's a very good comment, because you might have, in some cases, people, and we've learned many times, I mean, this hasn't always worked. Many times we've learned from efforts that we've done where nothing has moved along, and so lesson learned. Really key to have a combination of technical and political support. So engaging with the higher level hierarchy at the political and decision-making level is really important, because the decision makers will provide the space and the time for people working in more technical areas to actually engage in the work. So it is a combination of that. And there are some models that are interesting in the US that work in similar issues. I can give you, one example, the Chicago Crime Lab, for example. They work very directly with the office of the mayor. They're literally across the street. And so they have a lot of technical work between academics and people who work on the technical areas in city government, but also very closely linked with city government at the political level. So those two are really important to actually engage in action.
Great, thank you. And while we're on that topic of who's engaged, we got a question from Anna about including healthcare professionals and clinicians. Is that an explicit part of the process, or is it up to each country to determine who those key players are?
That's a good question. We typically let the countries select who is going to lead the process. Typically, there's an institution. It has normally been a ministry when we do it at a country level. At a city level, of course, it would be a different type of institution. But typically, it is the local setting where this is happening that chooses who is going to coordinate and who are going to be the participants. Just to give you an example, in some countries, we've had the Ministry of Justice lead this process. In others, the Ministry of Women, where it exists. In other, the Ministry of Health. In others, it's been Child Protective Services. And in others, it has been the Ministry of Security and Police. So a wide variety of organizational structures, but all of them have something in common. They involve every single institution. They also involve civil society, and they involve professionals and academicians. So it's really important to have a common goal here, because in many settings, for example, the participation of academics or professional organizations are the ones who are actually engaging in the work, because the government maybe doesn't have enough bandwidth to actually conduct that work. So engaging with non-government organizations in some settings is really important, and their participation is essential. That is organized at this sort of initial setup of that multi-sector group. But that group changes over time as the data are produced and as this whole initial recommendations are produced. When we arrive to the data to action component, and then the design of the National Action Plan, typically what we see is that the group is enlarged, and sometimes there's a shift in the organizations that are going to implement this, because they transition from a survey into a National Action Plan. And so the organization might change, but the process is still the same. And that's That's why communication and the political support are really, really important, because all those threads and all those changes are important to maintain over time so that we actually can come up with a final product.
Great. We're getting some different questions about sort of translating interventions across boundaries of culture and different contexts. And have you run into issues in doing that and taking a program that may have been successful in Uganda and taking it to another country, things like that?
Super important question. So in the technical package that I showed you, one of the tools is the Inspire Manual tool. And that Inspire Manual tool is basically an implementation science tool. It's a tool that helps us translate interventions. Now, that particular tool is limited to some of the interventions that are within the framework of Inspire. That doesn't mean that we cannot implement and apply principles of implementation science and translational research into projects that we have. Many times, for example, let's suppose one of the priorities is to work on home visitations. Well, there are multiple programs and multiple ways of doing home visitation programs or supporting parenting that can be directly in their homes or through community organizations. So a very specific setting might be more community oriented. A particular cultural approach might work better from working with the community than individually with households. And so the principles and the interventions can be adapted. And there are a series of questions in the manual that can help you think about the adaptation of those interventions. When we do the national action plan and we generate the priorities, why in the phase of priority setting, the mapping of what exists in the country is important is precisely because of that. It's because we know there are a variety of institutions, a variety of interventions that are implemented in a country that will require an adaptation. Maybe a home visitation type of program exists and it just needs an added element that doesn't exist, and or maybe it just needs scaling up. So the exercise is a scaling up exercise. Maybe it needs an adaptation to a different cultural environment. So those principles are in part in this tool that is described, but overall and in general, these principles of translational and implementation science are really, really important. And many times we arrive to them through asking questions. Okay, what is the principle of a specific intervention that is evidence-based? Where do we want to get? What is the action? How can that action be translated from the context of Uganda, where the organizations who were doing it were X, into another setting where the organizations that are going to be doing it or could do it are Y? So translating those activities and finding a common ground is really important. We actually do, in the process of the National Action Plan, we do activities with the government where we work on answering those questions. In the process of answering those questions, we actually engage and devise the adaptation of those interventions.
Wonderful.
That's a crucial question.
Yeah, that's super important. And thank you for covering that. We're getting a number of questions about sort of the data collection process with the survey. So one was, is there an incentive for folks that participate in the survey? Also, are there resources provided for people who may, either be experiencing violence, when they're completing the survey, or be dealing with potentially trauma or after effects and need help accessing resources? And then a third question, are you measuring exposure to community violence, firearm violence in the community, things like that in the survey?
All excellent questions. And yes, so we depending on the setting, usually in global settings, we don't provide any incentive. We basically we go through a process of consent with heads of household. When the interviewee that is selected is older, is an adult, we just get their consent and interview them. When it's a minor, we get a consent from the head of household or the caregiver, and then get an assent from the individual who's going to do the interview. And we conduct the interview, and if there are a series of conditions where we to 100% of the people, we leave them with a set of tools and information that is adapted to their country and their region and the setting where they live, giving them information that where they can actually access a variety of services. This is embedded within a longer list of useful services related to healthcare, security, police, social services, etc. But every single participant gets, and every single household gets that information. For individuals who either become upset in the interview, for any individual who actually tells us that they have experienced violence, or for in the cases of acute form of violence, for example, or acute cases, what we define, an example could be a person telling us, well, I'm actually thinking of committing suicide, or I'm going to be raped in the next few nights. Those are acute cases. We do have a mechanism for, the surveys are anonymous. So what we do is we have a mechanism and we create a whole infrastructure of response within each country. And we provide that information to the response groups who are completely disassociated with us or with the group that is collecting the data to preserve anonymity. And that actually gets transferred to those services who actually provide the response to this individual. So we are ethically obliged and to respond to 100% of the individuals. We do ask them whether or not they want services. Many of them say no. If they say no, well, we can't force them, but we still leave them with the information. If they say yes, we are obligated to actually provide that service to them and ensure that that service was provided to them. So we work with a variety of organizations, and the training that we do for this is quite complex. We actually, to collect the data for the survey, we do 3 weeks of training, and some of it is there's about 2 or 3 days where we work exclusively with the response teams on how it's going to be organized in a particular setting. I might have forgotten another question.
The community violence was the last.
Yes.
Measure community
Yes,
violence.
absolutely. We do collect information about violence in the home, violence in the community, witnessing violence, and use of firearms. Sometimes taking weapons to school, or sometimes use of firearms. We ask also about perpetration of violence against the intimate partner. So it's a very comprehensive set of questions. We ask questions about alcohol consumption, substance abuse, smoking, so a series of other behaviors, and of course the engagement in utilization of safe practices in sex, etc. We also ask a bunch of questions around that too.
Wonderful. Thank you so much. We unfortunately are out of time. I'm sorry we didn't get to all the questions, but I want to thank Dr. Villaveces and all of our attendees for joining today. I will be sending out some resources after to learn more about Inspire and get some of these additional questions answered. I want to note that Peter says, wouldn't it be great if this was happening in the US? And it is starting to. So we can share some more information about what's happening in the US as well. But I want to thank you again for sharing more about this work, and for everyone coming to listen in, and we'll see you hopefully at the next session.
Well, thank you very, very much for this. I'm happy also to provide some additional resources, both on the surveys as well as on Inspire, as you mentioned. Many of these resources are free. You can download, and so it'll be useful there. Thank you very much.
Thank you. All right, take care.
Bye-bye.